Let's talk about reflux and what it is. Infant reflux is when babies are constantly and frequently spitting up either during a feeding or immediately after. And it's not just normal small spit ups that every baby has, which is actually normal. Most babies do spit up occasionally, but I'm talking about large spit ups that are often distressful to the baby. Most babies don't react when they spit up, but a reflux spit up is painful and doesn't feel great to the baby. Usually true reflux also causes further issues for the baby, which we will discuss. These first three symptoms I want to elaborate on. As I touched on earlier, a huge part of what reflux is spitting up frequently and in large amounts. Like I said, babies do naturally spit up. Sometimes it's because they drank too much, or if you imagine as an adult, if you drink a lot of water, you might burp or hiccup and a little bit of water comes back up, but we just swallow it, or it just goes away. But for a baby who doesn't have reflux, that might come up just as like a little on your shoulder, on the burp cloth, if they're playing right after, doing tummy time right after a feeding. That is normal. For reflux, spitting up is more grand, right? It's like projectile, uncomfortable, baby reacts to it. It's not just a little hiccup of spit up, it is a full-fledged, almost like vomiting. The second symptom could be signs of overeating, which could be like hiccuping or coughing during a feeding. That's because they are starting to get the reflux in their mouth, in their throat as they are feeding, and so their body is trying to dispel it. Baby may also seem uninterested in eating or upset or uncomfortable during feeding. This is another sign of reflux, because most babies absolutely love to eat. So when your baby does not seem interested or upset, it's a sign that something could be going on. You may notice baby either swallowing or gulping after a feeding has been completed and after they've already been burped. This again is them regurgitating or having more milk come up than is supposed to come up with the stomach acid, and they're trying to swallow it back down, and it's very uncomfortable. You may notice that babies are very, very upset and not really easily settled. And the last one is that they often have issues with having enough wet diapers every day or even gaining weight. And this is because they are not able to take in adequate amounts of milk to grow and have the amount of diapers that they need to, because they are not able to digest and comfortably eat. It's really important to work with your pediatrician. Every baby's different. Every baby's path with reflux will be different. But some things that they might suggest would be switching formula, or if you are breastfeeding, changing up your diet, whether it's removing soy from your diet, dairy from your diet, testing for other allergies to see if that might be an issue as well. The next thing that they might do is tell you to implement pace feeding or holding baby upright for 20 plus minutes after a feeding. This is to help make sure that they are starting to digest the milk before laying them flat and triggering any sort of reflux response through the esophagus. They may also suggest feeding baby in smaller amounts more frequently, whether you're breastfeeding or bottle